eSOAP note. The electronic SOAP note, or eSOAP note, represents an opportunity to demonstrate your documentation skills and to formulate a differential diagnosis, diagnostic and treatment plan using keyboard data entry to complete the SOAP note portion of the encounter. Your electronic SOAP note will stand alone in representing your evaluation and documentation of the case. Following the 14-minute encounter, you are given 9 minutes to complete the eSOAP note. If you have finished the encounter early, you are permitted to begin your eSOAP note immediately upon exiting the examination room. Document significant findings from the patient's history in the subjective portion of the eSOAP note. Document your physical examination findings and any other key objective findings in the objective portion. It is generally advisable to avoid or limit abbreviations in medical documentation due to the lack of standardization and the potential for medical error. If you desire to do so, it is advisable to use only those abbreviations that are considered standardized, that would be easily recognized by the osteopathic physician examiners scoring the eSOAP notes. A list of common abbreviations is included in the online orientation guide and will be posted at each eSOAP note desk. Be advised that the use of uncommon, unrecognized, or dangerous abbreviations can negatively affect your eSOAP note scores. Candidates should try to be as specific as possible when documenting physical findings, avoiding the word normal. For the assessment section, you will be evaluated on your ability to accurately and plausibly diagnose the patient's problem. You'll be asked to list at least 3 diagnostic possibilities for the patient's presenting issues. This should be listed in a differential diagnoses format, with the most likely diagnosis for the presenting concern, symptom, or issue listed first. For health promotion, disease prevention visit types of encounters, if providing a differential diagnosis would not be relevant, candidates may list the patient's problems in a problem list format or list relevant risk factors for the area of concern. Again, avoid abbreviations in this section. For the plan component, you should note any workup or treatment that you would propose for the patient, including questions or physical exam maneuvers that you inadvertently did not ask or perform, but would plan to if time allowed. In most cases, specific drugs or drug dosages are not required, but candidates should try to be as specific as possible when referring to diagnostic tests. For example, serum electrolytes, BUN, creatinine, and glucose, as opposed to blood tests, SMA7, or chemistry panel. With the exception of vital signs provided, under no other circumstances should a candidate document the results of physical examination or treatment maneuvers that were not performed or medical history that was not elicited. Documenting results of physical examination or treatment maneuvers that were not performed or medical history that was not elicited will be considered irregular conduct and will be thoroughly investigated and dealt with according to NBOME's policies and procedures. NBOME has invested a significant amount of time, care, and resources in assuring you a safe, secure, and valid examination. An online tutorial for the eSOAP note is available on the NBOME website and includes the options to watch a sample encounter and view an example of a completed eSOAP note. As part of this module, you can also practice typing an eSOAP note just as you would during your examination.